This video is part of the Biology 282 Anatomy and Physiology lab experience on the heart and blood vessels. And this is taking blood pressure. Blood pressure is a vital physiological parameter to monitor. And I hope that you can learn how to take it. Your Biology 282 lab kit has a stethoscope and a sphygmomanometer included, a blood pressure cuff. And so you can take your own blood pressure. And I say here that it is a vital physiological parameter. It's one that keeps you alive, and you need to monitor it because it's an indicator of many, many things. And so we need to monitor blood pressure. Here we see the correct position for putting the blood pressure cuff on. You wrap it around the upper arm over the brachial artery. The brachial artery is the big one that's coming down through the upper arm, and then you pump it up. You pump it up, we're going to see how far. You pump it up above systolic pressure. That's the pressure in your arm when the left ventricle is contracting. And then you place the stethoscope over that brachial artery. So this is the correct position for putting the cuff over the upper arm, over the brachial artery, then pumping it up above systolic, placing the stethoscope over the brachial artery, and then you can let that pressure off gradually. And as you let it off gradually, you have a meter, and you can record the pressure. We'll see more about that on the next couple slides. Okay, here's the setup. The cuff is put over the brachial artery. Here's the brachial artery, which is going to branch to the radial and ulnar arteries. Okay, and then you pump that up above systolic pressure with this bulb, and you have a meter which will tell you how much pressure is in that cup. Okay, and then what you do is you pump it up above systolic. We'll see on the next slide a little more detail. Then as that pressure comes down, okay, then you'll be, right now when you're above systolic, that cuff is acting like a tourniquet. So no blood is going through the brachial artery into the arm. It's just blocked off. But as that pressure comes down and you hit the point at which the blood can start to enter the arm, that means the heart is pumping with a greater pressure than the resistance of the cuff. It's kind of like the jam breaks loose. All of a sudden there is a turbulent inrushing of blood down the arm, and you can hear that through the stethoscope, which is placed right down here. You can also see it on the meter if you watch it. The needle will be coming down very smoothly, but when it hits systolic, it will begin to tap, 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 tap. And then when it hits diastolic pressure, that's the pressure when the left ventricle is relaxed, then that needle will smooth out, and you'll also hear a second sound as you hear the blood going from a turbulent flow to a smooth flow. Okay, so you pump the pressure in the cuff up above systolic. That acts like a tourniquet. No blood going down the radial artery because it's blocked off. Then you gradually let the pressure off, and as it comes down and it hits systolic pressure, that's when the pressure in the left ventricle of the heart is greater than it is in the cuff. Then there's going to be an inrushing of blood into the arm, and you can hear that in the stethoscope. You can see it in the tap of the needle. Then as you get down to the diastolic pressure, that flow is going to smooth out. You can hear that in the stethoscope. You can also see it on the needle. I like to watch people take my blood pressure and then say, you want me to tell you what it is? All you have to do is watch that needle. The stethoscope's more accurate, of course. And now here, this explains what I've been trying to tell you. The cuff pressure is inflated above systolic pressure. That means it's going to act as a tourniquet. There's going to be no blood. See, they have the brachial artery drawn really, really small. That means blood is not coming in there. As a matter of fact, there is no blood flow. It's occluded. That means closed off by the cuff. That above systolic for most people is somewhere between 150 and 200. Okay. Then at systolic pressure, the pressure in the cuff is released to below systolic but higher than diastolic. So when it's coming down, okay, then you can hear a sound when the blood starts getting back in that, flowing through that brachial artery. You can also see the tapping of that needle. There's also mercurial sphygmomanometers. That's what this is. It's got mercury in it, and you can see the mercury start to bounce up and down when it hits systolic. Those are called Korthoff sounds. Okay, and then you can hear a second sound when the blood flows easily and freely. That's diastolic pressure. When the pressure in the cuff goes below diastolic, then it begins to flow very smoothly. You hear the disappearance of sound is really what you hear, but you think it's another sound. And then the blood flows freely, and that second sound you record as the diastolic. So I hope you use the sphygmomanometer that is in your laboratory kit and use your stethoscope to determine your blood pressure. And here is the conclusion of the matter. Okay, the blood pressure is a very important vital parameter to monitor because it tells about the health condition of the person. If the blood pressure is too high or too low, that needs to be looked at as a serious condition, and it needs to be corrected and dealt with medical intervention. You wrap the cuff around the upper arm, you pump it up above systolic, then you lower the pressure until you hear a sound, record that first sound. That's systolic pressure. That's the pressure in the arm when the left ventricle is contracted. Then you record the second sound as the pressure comes down. That second sound is diastolic pressure. And that's a pressure in the radial artery when the left ventricle is relaxed. That's usually recorded, and normal blood pressure is in the range of 120 millimeters of mercury over 80 millimeters of mercury. Millimeters of mercury is just the pressure unit. And again, the final conclusion is that monitoring blood pressure is an important aspect of medical care.